In every typical African society, whenever there is an issue with conception, the first suspect is the woman. In most cases, some men refuse to join their wife for fertility check. Hello there, thank you so much for joining us on this edition of Fertility Half Hour. And today we shall be looking at male factor infertility and treatment. Joining me in the studio, as usual, is Dr. Nsikak Nyoyoko, a fertility consultant. Doctor, welcome to the program.
Thank you very much.
And also with me today to discuss this very important topic is Agbo Oke, clinical embryologist. Agbo, good to have you.
Thank you.
We are looking at male factor infertility and treatment, and don't forget that this program is sponsored by Life Point Fertility Center here in Oyo, Akwa Ibom State. My name is Clement Barakui. Thank you so much once again for joining us. Male factor infertility and treatment. Dr. Nyoyoko, what is this all about?
Okay, the male factor is, I want to talk about male factor and infertility. We're talking of the conditions that cause infertility that is either contributed by the man alone or by a combination of the man and the woman, but the man still has a role to play in such conditions. That affects about 50% of infertility is caused as a male component involved in it. About 50% of infertility, either about maybe 30% could be the man alone, and then the man in combination with the woman up to 20%. And we usually classify the causes of male factor infertility to be pre-testicular, testicular, and post-testicular. Remember that to have a baby you require a matured, high quality sperm meeting a good quality egg. Good. So if we have a problem with the male sperm, whether abnormal in terms of number, normal in terms of motility, abnormal in terms of morphology, that is the shape and all that, the sperm is supposed to have one head. Some have 2 heads, 3 heads. They are abnormal. They cannot function appropriately. So that's male factor infertility in a nutshell.
So male factor, looking at the topic, you are talking about, possibly we are looking at only the man. And Mr. Okay, I'm going to ask you, in Africa, just like in my opening remark, in African society, we know that once there is issue with conception in the family, in fact, the mother-in-law, my son is all right, my son is strong, So what can you say about this issue? Some men also find it difficult, to join their wife in the treatment process. What message will you have for us?
Well, it's very funny, when especially the African setting, where every man feels the reason why the wife can't get pregnant for him is because of the wife. There is this particular thing I and my colleague used to say in my center. We say the man shoots blank. Yeah. Shooting blank means the man feels in as much as he's ejaculating.
Yes.
Yeah, there is sperm.
Yes.
Of course, that is not what is responsible for pregnancy. You need a spermatozoa. You need a matured spermatozoa, which is a cell. So all those things you see is an embodiment of a lot of things, plus the sperm cell. So a lot of people compare before you now classify a man. Before you say a man has a bad sperm, you subject them to some investigations, tests. You do seminal fluid analysis, and the analysis will be able to help you know if the man have a low sperm count, if the motility is bad, if the morphology is bad, or if again we have low sperm count. Sometimes the blank means there's nothing, just ejaculate. So those are one of the reasons why women don't really get pregnant. Yeah, so the best option for them, of course.
Okay, so we will look about the treatment options in the course of the program today. But doctor, let's look at the causes. initially, I think you've talked a little bit about
Just
just classify them. But let's go into details now. Let's look at the causes of male factor infertility.
Okay, the causes could be very many actually. We could have causes that are as a result of genetic causes. The person was born like that, born without maybe born without testes, or the testes was undescended, it's in his tummy, it's not down. Most men, normally a man's urethra, the opening of the penis at the end, at the tip, for some it may be lower down. So when they ejaculate, it's not going into the woman, it's coming out. Those are still genetic problems. Then there are other problems. Even I'll just mention the common ones. Diabetes, uncontrolled diabetes is a problem. Hypertension, okay, sexually transmitted diseases. That's why when people are beating their chest for their sons, as you said, you say, my son, she doesn't know if the son has contracted the sexually transmitted disease along the line, and that would have caused a problem, okay. So the other genetic things, issues are also there. Then you also have problems of even ejaculation. Some men don't have a problem with ejaculating, then low libido, poor erection, all those also come into play. But one of the commonest ones are this infection. Then 50% of them actually won't be able to find the cause. It's idiopathic. You just can't tell why this person is not able to have, why the sperm is gone and what is happening to them. So those are the common causes of male factor infertility in our environment.
Okay. So let's look how common is male factor infertility in our society. Can we say that the male factor is more higher than the women?
It's equal, 50-50. It's actually 50-50%. When we were in school, it used to be 30% male, 30% female, and 30% combined. Okay? Combined factor. And then the 10% what we call unexplained infertility. But now, research has shown that when you look at the male factor on its own, its contribution alone and in combination with the female factor is up to 50%. And the female to up to 50%. So we can't hold anybody responsible until we run the series of tests, just like you have said. We need to run tests, and then we now know that, okay, this is where the problem is. The ejaculate you're talking about is the fluid that the sperm swims in. Okay, some men ejaculate, they see fluid coming out, white fluid, they think the sperms are inside swimming, but there's no sperm there. It's just water that is coming out. And so they could be deceived to think that they don't have any problem.
Okay. What in our last edition, I remember you talked, he said something about that you can't see the sperm with your two naked eyes.
Yes.
Okay, so that could be the reason why when you just see the fluid, you just assume that it is. Okay, so okay, let's maybe advise couples at the end of the investigation, as you just said, you've seen the cause. Okay, this person is responsible, this person is responsible. What should be the case? Well, I know that there are some men, once you discover that it is my wife that is responsible, they just push your blame on her and they feel relaxed. What is your advice?
Well, since we're discussing about male infertility, in cases like that, normally couples are supposed to come in to see a doctor. Then you ask a few questions, subject them to laboratory investigations, and the outcome will not determine, because you don't just sit at home and feel it is my wife. Yeah, someone have to tell you that this is the cause of your infertility, right? Then if you come to the lab, if you come to the hospital rather, and it is noticed that the fault is from the man, we have different options of treatment.
Okay.
And of course, our basic discussion today is IVF. IVF is one of the ways we can treat it, because the end point is for the couples to achieve pregnancy at the end of the day.
All right. Yeah. So the end point is to achieve pregnancy. So Dr. Onyeko, let's still talk a little. Let's talk more about the treatment options. Yes, talked about IVF. Is it only IVF, or maybe possibly that is the most guaranteed treatment option?
Okay, well, the treatment options depends on the cause actually. For instance, if it's diabetes, you will treat control diabetes, control hypertension. Those ones are easier. If the person needs surgery, maybe because of blockage of one blockage of the ejaculatory ducts, or the varicoces are swollen, the veins there, we could get, the urologists are the ones that assist in taking care of those surgical aspects of the man's problem. But sometimes, a lot of times, you do all this and the problem is still there. Or, like I said, 50% you can't find the problem. And then the man has the grace of oligospermia. Oligospermia is reduction in sperm counts. We have the mild, the moderate, and severe. Yeah, and then we have azoospermia, no sperm at all. So the problems, if the problem is a blockage at the ejaculatory duct, then probably we can use a syringe and aspirate sperm from the testes, which we call TESA or PESA, percutaneous sperm aspiration or testicular sperm aspiration. Those procedures are pre-IVF procedures. They used to get the sperm for ICSI actually. ICSI is an advanced form of IVF, which is a party area for the urologists. That's where they have their power is totally. They have a lot of powers there. That is the urologic ICSI. Okay, so if it gets to that point, you may now need ICSI after trying every other surgery and medical treatment. If it gets to the point, it is severe, because oftentimes severe oligospermia is what we see, or azoospermia is what we see. But then in minor forms we can try IUI, try insemination. But then that question you also asked, that a man sees his wife and stays, and once the wife has one small factor, maybe fibroid or something, the man says, oh, you see, the cause. Remember, we've said that there's also the combined factor. The man can have a problem, the woman can have a problem at the same time. The man problem might even be a smaller one. It could be one fibroid hanging somewhere that will not affect anything. Meanwhile, the man doesn't have sperm, or his sperm is low. So we need to we encourage all men that, just like he said, when they come to see us in the clinic, they should come together. By the time the man is asked to run the test in front of the woman, he has to say the no in front of us now. All of us will know that he doesn't want to do anything about it. But oftentimes we see our clients come alone, as women come alone, the husbands are not there, and then you now tell the woman, go tell your husband, and they're telling you, doctor, when I reach home I'll call you to talk to my husband. And I'll be like, are you not the wife? You should know how to play with your husband and get your husband to listen to you, But it's better they come together so that we can actually advise them appropriately.
Okay, so still talking about male infertility, and you know that you just made mention of the issue of low sperm count. Is there treatment if it is the person is having low sperm count? Do you at that point possibly advise for a donor, or you embark on a treatment to boost the sperm?
Okay, like I said, low sperm count is in great. If it's azoospermia, that is no sperm. And we've run some tests and we realized that the problem is from the testes. Testes are not producing at all. Because sometimes it can produce and it's a blockage. So you won't see sperm in the ejaculate. But if it's not producing at all, that's when I talked of aspirating from the testes. I'm sorry, if it's not producing at all, that's when I talked about having to, we'll now start talking about donor, getting a donor, because we cannot get sperm from anywhere. But if it's as a result of a blockage along the ejaculatory part, that is the test is producing, but it's not coming out, then we can aspirate from the testes there. So it's in severe cases.
But if it is low, can you boost it?
Yes, if it's low, it can be boosted. It can be boosted because what feeds sperm are their micronutrients. So we have some drugs that we can give. Yes, that we can give to boost. But the man should be patient and not take it for up to 3 months. Okay. Yes, you have to take for up to 3 months. But that will take, because it actually takes about 84 days for sperm to start from baby to adult to mature. It takes about 84 days. Yeah, so we can give some drugs that will help, but that is in milder forms of oligospermia. if it's the more severe ones, we need to do more investigation to find the cause and overcome the cause.
All right. To find the cause and overcome the cause. In the course of your discussion about the treatment options, you talked about IVF, and then you also made mention of ICSI. I know okay is going to talk more about ICSI, but that will be after this break. So we are going to pause a little bit and go for a break. You are still watching the program Fertility Half Hour. Remember that this program is proudly supported by LifePoint Fertility Center. Don't forget to visit the center if you know or you have anyone that is facing the issue of conception. We shall be back after this break. Stay with us. Glad to have you back, and don't forget that this is Fertility Half Hour, and today we are looking at main factor in fertility and treatment. Before we went on the break, I was about to ask the issue of ICSI. So, okay, what is ICSI?
ICSI is a very simple process. You know, some people normally, we know how this thing works, and where you're having sex with your wife, that's in vivo now, you ejaculate, you need active sperm to swim through the fallopian tube, then to meet your wife's egg, right, for fertilization to occur. But the reason why we do ICSI is because we remember I said in our previous episode that we try to mimic everything that happens inside, outside the controlled environment. Now, because the sperm is bad, normally we are supposed to allow this sperm to swim towards the egg to achieve fertilization. But because the sperm is bad, that cannot happen. So what we do is we tend to aid fertilization. Then how do we do it? We prepare the sperm, then pick them individually, because of course you need just one sperm to fertilize one egg, right? So you prepare your sperm, you prepare your egg, then you pick one sperm and inject. It's called injection. Okay. You inject it directly to the egg for fertilization to occur. And of course, ICSI increases the chances of fertilization. Yeah. So that is what ICSI is basically all about.
Okay.
Taking one egg, one sperm, inject them to achieve fertilization. That is ICSI.
So this entire process is being carried out by the embryologist.
Of course.
Okay. Now let's look at the indications, and that's going to be for Dr. Nyoyoko. The indications for ICSI. At what point do you recommend ICSI?
Okay, for a man with a very low sperm count, where we're talking of, the normal sperm count is supposed to be from 15 million and above, and then we're talking of someone whose sperm count is less than 1 million, or you can barely find spermatozoa. Then, like he said, ICSI just need 1 or 2 or 3 sperm cells to pick one, the best, and inject into the egg. Okay, then where in situations where maybe there's a blockage of the ejaculatory duct, so the sperm is produced in the testes but cannot pass and come out. So I have to use a syringe now to aspirate the sperm from the testes where it's produced, which we call, there are different forms. You can call percutaneous sperm aspiration, testicular sperm aspiration, or testicular sperm extraction. Now when we do all that, whatever you get will be in few quantities, definitely, and you now have to subject it to ICSI so that you can get the best value for, let's say, for your efforts. So I can get the best value for effort. Then also, I think also in situations where we have what we call pre-implantation genetic diagnosis, which we use in analyzing embryos that have problems like sickle cell anemia, so I can exclude them from the transfer process. Or these days people use it for the gender balance, family balances. You know, where you can determine the sex of the baby you want, a boy or a girl. So those, in that situation, then conventionally people would go for ICSI, so that they'll take their time. They have eight eggs. They put 8 sperms. Like as Agbo said, the possibility of fertilization is direct. You are directly fertilizing, so you are more sure that you are going to get 8 embryos from 8 eggs from the fertilization process of 8 eggs. So they are not missing out any of them by chance, but you are doing it directly yourself. So that's also an indication for ICSI. Then also, people that have tried IVF severally and have failed, sometimes there's this option of, okay, let us push this thing ourselves and see what will happen. And then ICSI is indicated in that at that point.
All right. So finally, okay, let's as a parting word, we are talking about transportation now. And I remember in our last edition we were talking about preservation, prior preservation. We talked about how long an embryo can last.
Yeah.
So how do you do this movement?
Okay. First and foremost, cryopreservation will come into play.
Yes.
Right? Especially if you're transporting this tissue outside the shores of this country. You generate your embryos, right? I'm using that word again, generate embryos.
Yeah.
So you get your embryos first, right? Embryos first, biopsy here in our center before we send them. Now, at that point, since the result doesn't really come in immediately, what we do is we freeze those embryos individually. You have 8, so you level them properly. Embryo A, embryo B, embryo to Z. Of course, when your result comes, it comes in that form, A, B to Z. So you first of all generate your embryos, you get your biopsy, you freeze them, then send the tissue out. Then when the result is ready, they send you a mail. You know how to identify them.
Oh.
Sometimes you might analyze 12 embryos and all comes as SX, that's female. Sometimes. So it is not really a guarantee that because you paid money for PGD, for sex selection, and when the result comes out, you will have a boy. Right? It's true.
And that raises another issue.
Yeah.
Okay, I need a boy, and then all the eggs come out female. How do you handle it?
Well, the truth is, you should understand that we have 2 chromosomes. We have the Y, we have the X. Now, the man is responsible for either X or Y chromosome, while the female, that's the Y, is responsible for X. So it is either
the man.
It's either the X from you or the Y from you, right? So all what we do is we inject. So the sperm we are injecting could be the X, it could be the Y. So at that point, if the result comes out as that's female,
it's what you gave to us that we're giving back to you.
So doctor, how do you advise the couple at that point? I'm looking at a situation how you will be able to, calm this couple down. How you'll be able to advise them on next steps to take. Or in taking that step, will you advise a donor?
We usually counsel them before we go start the whole process. Get them to understand. Get them to even sign consent forms with perfect understanding of what the possibility could be. In fact, we give 4 scenarios. 1, all could be abnormal embryos. 2, it could be all female. 3, you could have males, but abnormal males. Like those that might be there, maybe abnormal males. Then 4, you could have some normal males. So you have to get that
just
clear
and
prepare your mind. Like any of those 4 things that you meet, and that is why we tend to increase the odds, the possibility. We request for a good number of eggs.
Okay.
Some centers will say get up to 8, some say get up to 6, some say get up to 10 or 12 eggs, so that the positive chances should be higher.
All right. So Well, it is on that note that we I don't know, you have something to say?
Yeah.
Okay.
I just wanted to, since we are talking about PGD,
Yes.
now I just want to use this opportunity to talk to those lovebirds who feel because my genotype is AS and my spouse is AS2, we can get married. Yeah, you can also take advantage of IVF and PGD.
Okay.
Yeah, because at the end of the day, we should be able to screen out the sickle cells and give you the number.
Wow. Okay, that's very important information. So the issue of having a sickler in the family will be ruled out. So okay, so couples can still go ahead and marry if they have AS and AS, but have that in mind that they are going to go for IVF. All right. So thank you so much for being a part of the program. I'm sure you've learned one thing or the other today, particularly for those who are very, very much in love, but your genital AS and AS. The advice, the option there for you is just to go for IVF, so that can be treated. You can have children that are healthy and strong. Thank you so much for being a part of the program. Remember that this program is supported by Life Point Fertility Center here in Oyo, Akwa State. A visit to the center will actually make you smile. I remain Clement Barikui. See you again in our next edition.
I'm ready for this.
I am a winner.
I'm special.
I can do this.
I'm going home with the prize.
I'm going to grade the shoot.
I'm undefeatable.
I'm winning this.
All right, you're welcome, contestants. I'm sure you're feeling great today, but the gameplay still remains the same. There are 3 rounds in this elimination stage. Round 1 is fastest finger, where 11 contestants will play for the 8th slot in the second round, which is 60 seconds to think. After which we move on to the third round, which is questions from the cowbell media bank.